Hey guys, Dr. Brotsky here. Welcome to month number 1 of your pregnancy. It's a little confusing because during the first month, you're actually about 4 to 8 weeks of gestation. So if you're confused about months to weeks, then you just subtract 4 weeks and then you can calculate your months, okay? Things that are very normal right now, obviously you're gonna have a positive pregnancy test. You will have just missed your period. Expect to feel very tired, like you can never get enough sleep. Another thing that's very common and normal is to have a lot of breast tenderness. You may have some bloating and constipation. You may have some mild pelvic cramping. And you also may notice that your concentration is less. So those things are very, very common and normal. From a doctor's perspective around this time, usually we like to see patients for their first prenatal visit between 6 and 8 weeks because that's when we can see a baby with a heartbeat on the ultrasound and actually help establish a due date for you. Also at your first visit, you can expect to have some lab work done. So routinely, what lab work we like to do is check your blood type. We do an antibody screen. We always check your blood count. HIV is recommended, hepatitis B testing is recommended, and syphilis testing is recommended. So your doctor will check all of that. Occasionally a doctor will check a thyroid level as well. It just depends on your family history and your personal history of medical problems. The other thing that your doctor may test for is a carrier screening test. So this may test for genetic issues that you may carry and potentially pass on to your baby. So the most commonly recognized one is cystic fibrosis, but there are different panels that you can get, and those are usually discussed with your doctor at the first prenatal visit. The other thing your doctor may do is update your pap smear and also make sure that we do a culture of gonorrhea and chlamydia. And that's just routinely done and recommended at the first prenatal visit. So an examination might be involved. The other thing they'll talk about with you that I typically go over is weight gain goals in pregnancy. For a singleton or a one baby pregnancy, we want you to gain anywhere from 11 to like 40 pounds in pregnancy. It just depends on what your body mass index was before you got pregnant. So for patients of a normal BMI, we recommend you gain 25 to 35 pounds, and that's throughout the entire pregnancy. Also, what I discuss with my patients at this first visit are diet and activity precautions. So for your diet, you need an extra 300 calories a day when you're pregnant, so you're not necessarily eating for 2, but you do need those extra calories. Small, frequent meals tend to work better than large meals. Protein is incredibly important in the first trimester, so make sure you're getting enough of that. It's usually the last thing that you'll crave in the first trimester. You also want to drink plenty of water. Up to 64 ounces a day of water is what you should really have when you're pregnant. The demand increases, so you should drink mostly water. A small amount of caffeine has been studied and been shown to be safe in pregnancy, up to 200 milligrams, for example. So you don't have to totally cut out your daily cup of coffee, just mostly drink water like I mentioned before. The other thing I talk about is activity precautions. So I usually tell patients whatever you're conditioned to doing before, you can really continue to do during the pregnancy as long as it wasn't anything strenuous or really extreme. So if you're used to lifting weights or working out, you can continue doing that. Just don't increase your weights, maintain what you're used to lifting. And if you do cardio, just make sure you don't go over 80% of your maximum heart rate. So usually cardio machines can automatically calculate that for you when you plug it in with your age, but in general, your maximum heart rate is 220 minus your age. So you take 80% of that number and you shouldn't go over it. And that's how to figure out how to control your cardio. Drink plenty of water also. You can have intercourse, you can go swimming, you can go on a hike if you want to. Just drink lots of water and wear sunscreen. And the only thing you can't do is get in a hot tub really, because it can change your core body temperature, which can affect development of the baby. So those are the most common things I go over. You can ask your doctor as well what hospitals they deliver at. Make sure they take your insurance, which they've already probably made sure of before you've seen them. And make sure that you understand how often you'll come in to see the doctor. Usually it's every 4 weeks with the first and second trimester unless there's complications. Things that you can be doing right now are taking your prenatal vitamin, take DHA as well if you can stomach it. Sometimes it upsets your stomach a little bit, so make sure that you are supplementing that as much as you can. You also want to watch out for any bleeding or severe cramping. Those are warning signs of a miscarriage and your doctor needs to know right away. And you want to drink lots of water like I mentioned, and make sure every time you see the doctor that you leave some urine for a sample, because bladder infections are much more common in pregnancy. So it'll get better and you'll have more energy soon, and pretty soon you'll start showing as well, which will be exciting. So that's it for month 1. Thanks for watching. Check out my other videos as well, and you can find me at drbrotsky.com.